What can cause diabetes in young children? How do they know if they have diabetes?
In the past, the overwhelming majority uh, of young diabetics suffered from type 1 diabetes, which is to say that the patient the patient's body stopped producing insulin, and therefore the patient had to be dependent on insulin injection lifelong. So type 1 diabetes was the overwhelming majority, was the cause of diabetes in the overwhelming majority of patients in the past. But in recent times, this seems to be changing because we have more of childhood obesity, young children who are not exercising, who are eating all the wrong foods, who are extremely overweight, and who therefore tend to develop not type 1 diabetes but type 2 diabetes. So, depending on so what I'm saying is that uh, type 1 diabetes continues to be the majority, to be the cause of diabetes in the majority of children. That is changing in the recent past. In recent times, we've got more of children developing type 2 diabetes as well. But still, if you look at a young child, then the more likely cause will be type 1 diabetes of of hyperglycemia in that person.
What are the most common symptoms of diabetes in children? What are the precautions to take?
So again, it depends on what the cause of diabetes in the child is. If, as happens in the majority of children, it is type 1 diabetes, then the patient could have a very rapid development of weight loss, increased hunger, thirst, and increased frequency of urination. And it is also possible, unfortunately, as happens in quite a few cases, that the patient who has developed type 1 diabetes, and this happens quite rapidly, actually comes to attention of the doctor because of having developed diabetic ketoacidosis, which is indeed a life-threatening condition and which necessitates immediate management within the ICU, administration of intravenous insulin and fluids, and subsequent transitioning to subcutaneous insulin regime, which is daily insulin injection. So these are the presentations that a child could come up in type 1 diabetes. So, depending on whether the patient has diabetic ketoacidosis or not, there could be different presentations of type 1 diabetes also. But in type 2 diabetes, the presentation may be more subtle. So the patient may have just some weight loss, may have increased hunger and thirst, and an increased frequency of micturition over a much longer period of time than is the case in type 1 diabetes. So a more slow, a more gradual progression in the case of type 2 diabetes in children. And once the patient is evaluated, will the diagnosis will eventually be made.